Raise your hand if you know what an opioid is. Raise your hand if you know someone that is struggling or in active addiction. Today I want to talk about the war on drugs, and the main one is addiction and opioids. Well, addiction to opioids. Let me correct myself. I first got into this, didn't know much knowledge of anything about this until I started working in a department for addiction recovery. And I learned so much, and it just touched my heart. And I believe this is my calling and what I need to do to help reach people and to help people. So I want to become an addiction recovery nurse. But today I want to also talk about what opioids are and the nationwide problem all over the country, as well as understanding addiction and what it truly is. And the third thing I want to discuss with you all would be different resources and how to prevent addiction and this war on drugs with the opioids. Okay? An opioid can be natural. It is used, doctors prescribe it for moderate to severe pain for someone that's had like a surgery, cancer, things of that nature. But the biggest problem is there is, according to the Surgeon General, or excuse me, not the Surgeon General, the CDC, 11.9 million Americans misuse opioids. And the biggest one would be fentanyl. Everyone, and I'm pretty sure I've heard or seen some kind of article or on the news about the opioid epidemic and how it's taken over and how people are overdosing on fentanyl. And there has been an 18%, I'm going to show you this map, and this is just in Alabama alone, has increased 11% in overdose, and that's just here in the state of Alabama. And this comes from Kaiser Family Foundation. This information was provided from Candace Rachel. She works for the Jefferson County Health Department, and she plays a huge role in my speech because I'll mention her name multiple times. But we're going to transition over to the second thing I want to discuss with you guys, so you know what addiction is, how to understand it, because it's something that once someone has this addiction, it is a chronic relapsing disorder. It's a disorder. It's a sickness. It's not, oh, they can stop that. They don't need to be doing that. No, that's just not how addiction works. And there's been more than 200,000 cases in the U.S. of drug overdoses because of someone getting addicted to an opioid. And that information was provided from the CDC. All you can do with addiction is just remember that it is a disorder. It is a disease. And also, I want to talk to you about how to help with this war on drugs, with opioids, or an overdose. I've learned some pretty cool things. I got certified within like 15 minutes to administer Narcan or naloxone. It is a nasal spray that is released 30 to 90 minutes to go up to the brain receptors to reverse someone that is in an active overdose. If you're not sure how, or if you know someone is, you just call 911. But there are detox centers to help someone get in recovery. But I encourage you to go get with Candace Rachel at Jefferson County Health Department. And she will get you administered Narcan. She'll give you your own kit. Kits are available on shelves at stores. But we also have an outpatient clinic that helps patients on a regular basis to keep them on their journey of recovery as well. But I just want you guys, leave you guys with this. The war on drugs it gets higher and higher every year. But we, being educated and knowing what it is, we can, as a whole, try to help in some kind of way. Thank you.